Hello, everybody. When you are trying to improve the processes of your company and your organization to really improve efficiency and be successful, there is a physician who I'm talking today who wrote this article on LinkedIn. If you've seen it, it's called How I Became a Document Whisperer. You should absolutely read this. Dirk Stanley is talking with us today, and he is let me just introduce you to him. I'll show you his picture first. But he's been a friend of mine, and he's also on Lead Physician as a guest speaker. This is Dirk Stanley, and he wrote this article here. Try to find it, and it's called "How I Became a Document Whisperer." So many times we are told to stay in our lane and do our own thing, and just concentrate on what you're doing, and don't think about anything else, and just do your job. And that kind of really causes stagnation in the organization. And I'm going to bring him on to explain all this. He is an expert workflow physician, a great leader. Hi, Dirk. Thank you so much for being here.
Hi, Elsie. Thank you so much for inviting me.
Yes. So he's a CMIO of UConn Health in Massachusetts. And uh, I know you do so many other things too, but one of the things, he's a board certified hospitalist workflow design, expert workflow designer and blogger. And he's an applied clinical informaticist and chief medical informatics officer. So Dirk, I saw this article and this quote that you put on there. If you care so much, this is what somebody told you. If you care so much about the clinical workflows, then why do you seem to care so much about bylaws, policies, procedures, guidelines, protocols, bylaws, charters, order sets, and other documents? Why don't you just worry about the things inside of the EMR? Stay to what you're doing. What do you have to say about that, Dirk?
So, it's interesting. I when I started my career, I did try to focus on the things inside the electronic medical record, and we often tried, building things that people were asking for. But I noticed that after a couple of years of doing this, I noticed that sometimes we built things that were disruptive or weren't well received, or when we rolled it out, suddenly there were a lot of complaints from another part of our organization, and it started to dawn on me that it's not just the things that we're building in the computer that are were the issue, because to fix what was going on, we often had to update policies, we had to change staffing, we had to change schedules, we had to educate people or educate patients. And so there's this whole other cadre of tools that we needed to deliver at the same time as the tools we were delivering inside the electronic medical record. And that's when it really started to dawn on me that workflow is not just shaped by what's inside the EMR, it's also shaped by the things outside the EMR. And we have to consider both of them anytime you make changes or enhancements to processes in an organization.
Yeah. So tell us a little bit, some examples of where this has happened, so that people understand.
Oh yeah, sure. So for example, there are often for complicated titration protocols, right? In an ICU, when you're ordering a particular medication. One project that I worked on with a previous employer was related to heparin, and to make heparin titration work properly inside the EMR required a phenomenal amount of staff education. It required policy updates. It required formulary changes. It required laboratory changes. It required, even patient education. There was a lot of things that we had to develop to make what was happening inside the EMR work properly.
Right. So there's a lot of collaboration that has to happen beyond, and you can't just live in the box and make the changes yourself and hope that somebody's going to listen to you.
And that they'll somehow just adjust to whatever you've done. Yeah, no, you really have to kind of think outside the box and think who else is going to be impacted by this, and invite them to the meeting and say, why are we doing this? And enlist their participation early in the project.
Right. So to your point, the second point is that any changes to workflows requires changes in both inside and outside.
Yeah. So as a informaticist, one of the things that I do, I hear from a lot of clinical people who say, Dirk, this is what I want to do. And so I listen to their concerns and I document what are they trying to do? I'm the blueprint person who helps develop those blueprints. But after I develop the blueprints, then I have to identify what inside the electronic medical record needs to change and what outside the electronic medical record needs to change to support the desired blueprints.
Right. And it requires a collaborative effort. So even those people outside need to look inside to the EMR.
For sure. Yeah. It's healthcare is a team sport. You need that collaboration.
Right. And that's not something that we're used to as physicians. We're told to be independent in our thinking.
The more I proceed in my career, the more I learn that it's all about teamwork and how do you engage people and how do you enlist their help in supporting your goals.
Right. So I want to bring up the third point that you brought up to me, Dirk. He says, look at things through a telescope, not a microscope. So what do you mean by that?
Actually, I think I think we have. I'm sorry. I think we have that backwards. We do need to look at it. I'm sorry. I don't mean to edit. Like,
No, it's okay. Go
I'm
ahead.
sorry. I don't know. I think that was. We do need to look at it through a microscope, not a telescope. But I don't know. Do you want to edit that
Yeah,
or
yeah.
okay?
But I thought you meant that that you need to look things through from telescope, meaning like the big view, and not just stay in your lane. And that's what I thought you meant. Is that
Well,
not what you
no,
meant?
but the tools in front of us, like all those documents, like when you look at them under a microscope, like you can see where the problems are. Like that's
Right.
we need to be able to do both, zoom
You
in
need
and
to do
zoom out.
both, then
Yeah,
yes, not just one way, but both.
yeah, maybe so. Look at things through both a telescope and a microscope. Maybe that's a better way of phrasing that.
Both, yeah.
Yeah.
And that's why I like StreamYard, because I could just change this.
All right. Sorry.
Yeah. So both, and this is for everyone to see. Bam. Look at things through both a microscope and a telescope.
Perfect. That's perfect. Yep.
Yes. All right.
So
That's why
I'll
this
let
is
you take.
dynamic learning here. Dynamic podcast. Great. Thank you so much. So, how difficult has it been to do that? Because I think that's the hardest part, is getting everyone to be aligned, and change management is not always easy.
It's change management isn't easy, but that's why I usually tell people it's helpful to look at things through both a telescope and a microscope, because you need to be able to zoom out for parts of the discussion, but you also need to be able to zoom in for parts of the discussion. And if when you zoom in you see problems, those problems need to be addressed. Very often you hear, in healthcare, we commonly employ the phrase, oh, don't worry about the details, let's just focus on the big picture. Well, at some point somebody does have to worry about the details, and if you don't get the details right, you will have unexpected outcomes. So it's important to consider both the telescopic view and the microscopic view of your workflows.
Right. I mean, extrapolating what you've been saying all along, a lot of physicians are being told, and I've had that experience myself, and I'm sure you have, being told, you just do the clinical work and I'll deal with the operations, you know,
Right.
or you do the clinical work and I'll deal with the administrative stuff. But
And
it can't work that way anymore.
no, I mean, yeah, we definitely need physicians to participate in solution development. And the
Yes.
more physicians learn about developing solutions, it's actually very empowering as a physician. Then you start to understand how workflows are developed. And then once you understand how workflows are developed, you can help shape them. And it's so empowering.
At the same time, we need administrative leaders to understand the clinical aspects. So from the ground up, being there in the front lines to see what is going on, and speak with the people, the staff, the employees, of where the problems are, so that they can together come up with the solutions.
Yeah, it's collaboration with administration is always vital. You as you said before, you can't just do it by yourself. You need to enlist their support.
So I was wondering, like, what was the response? I bring this up again, and this is the reason why I think you wrote this blog. If you care so much about the clinical workflows, why don't you just worry about what's inside the EMR and stop thinking about everything outside? What was your response to that person?
I said, I tried to, but to do my job, I had to focus on other things. Like we had a limited success rate when all we did was worry about what was inside the EMR. We have a much higher success rate when we consider both.
Very good. So everyone, just go into Dirk Stanley. He's on LinkedIn, and read the CMIO perspective, how I became the document whisperer. You also have a tremendous list of articles on dirkstanley.com. I want to show everyone, this is your website, and you have a whole bunch of blogs on there. what are one of the most insightful one I remember is about the red sneaker story in there. Um, and just talk a little bit about that because this kind of goes along with the whole workflow issue.
Well, so the red sneaker example is something I developed for physician leaders because very often I encounter a lot of physician leaders, and some of them are younger, and some of them, don't have a lot of introduction and don't have a lot of experience. So the red sneaker is the hypothetical example of, like wanting red sneakers. Like, there's some evidence or literature that says, oh, we need to have red sneakers. So, and how do you actually do that from a clinical standpoint? How do you get the red sneakers? How do you train people, about the red sneakers? What do you do if people show up to work without red sneakers? Like, there's a lot of thought that needs to go into procuring red sneakers. So it's sort of a helpful teaching example.
Yeah, I love that. They all made a decision that everyone's going to wear red sneakers, but then how do you implement that is a great analogy. I love to what's going on in healthcare.
Yep.
So thank you so much for this. I just want to show everyone kind of what's on your blog here. You have an operational pyramid. You show workflow development, document and tools. There's so many valuable tips that he has on his website. So go check out dirkstanley.com. Thank you everyone for watching. My name is Dr. Elsie Coe. I'm the Chief Medical Officer of American Endovascular Amputation Prevention, also the CEO and founder of Lead Physician Leadership Program. So if you want to, if you have a topic on physician leadership, please reach out to me at info@drlcco.com. And thank you so much for those who have reached out to me. And if you're interested in leadership program, we are starting again at the end of the summer at leadphysician.org. So check us out. Any last words of advice for our listeners?
Just get involved, develop solutions, and work with other people, learn from other people. It's always helpful. And I'm so happy to be part of your podcast, and I really appreciate everything that you're doing to empower physicians. So thank you so much for inviting me.
Thank you, everybody.